Dr. Michael Ryan with Missouri Vein Care, answering a question, when are varicose veins present in one leg only? Is that a common problem or not? And actually, it is relatively common to see varicose veins more prominent in one leg. Usually, there are some varicose veins in the other leg, but they're just not very visible or advanced. A vein condition is something that develops at a certain age and differs with every individual, and then every year it gets a little bit worse. Those veins grow and become more prominent, they enlarge. And so one leg has started ahead of the other. The other one usually, if you look closely, we'll see some varicose veins in the other leg. But in general, it's interesting that the left leg tends to be more involved than the right leg, especially in women who have had children. And it's likely related to the effect of the uterus and the pressure it puts on the veins going to the left leg. And so it's a little bit more common in the left leg. However, if people look down there and see veins in one leg, it's highly likely there's some in the other leg. And often, when we do a complete evaluation, which includes an ultrasound, we'll look under the surface at the function and location of all the veins. We very often see the varicose veins forming under the surface, and we know that they're varicose veins because normal veins generally run straight. So they run straight, maybe a little bit of a curve. They branch and they're like it's like a Y. It's very straight. But with a varicose vein, we can tell with the ultrasound that it's not normal because a varicose vein is filled with extra pressure, and the vein itself gets bigger and bigger and bigger. But it's like the balloons that you see that are the little wiener dog balloons, the really long ones. When you blow that up, it gets bigger this way, but it also elongates. The varicose veins in your legs elongate as well as get bigger. When they elongate, they have no place to go, and they can't expand beyond your legs, so that they end up making a S curve back and forth to avoid you know piling up on each other. So we see that with the ultrasound very clearly, and that's usually the finding is that the other leg has varicose veins. It's just in a more preliminary stage of development. So, Mike Ryan, answering the question, are varicose veins in one leg common?